guys, Brooke Klisiak from Legacy Physical Therapy coming back at you today to talk through the first 4 signs that you may be dealing with pelvic floor dysfunction. Remember in our last video we talked about how common pelvic floor dysfunction is, especially in the female population. And so there's a high chance that many of you watching this video might be dealing with some issues, and so I want to bring some light to that situation. So today we're going to talk about some of the common bladder symptoms that are a sign you may have pelvic floor dysfunction. The first one is bladder leakage. No amount of bladder leakage is normal. Okay, a lot of times people hear about it, oh, you know, don't make me laugh because I'm going to pee, or I know where every bathroom is, otherwise I'm going to have an issue. I don't jump on a trampoline anymore because I'm going to leak urine. So all of these are common scenarios, but they are not normal. We are not all marching down the path to go back into diapers, and there are some easy things that you can be doing to help with your bladder leakage that does not involve surgeries or medications. Here's a hint, pelvic physical therapy is one of those. But that's not what this video is about. This video is about talking about some of the common bladder issues that may be a sign that your pelvic floor muscles might have an issue. So leakage is the number one. Urgency and frequency is another bladder issue that is a sign of pelvic floor dysfunction. So urgency is getting uncontrollable strong urges to go to the bathroom. You may or may not have leakage with that as well. Frequency is going to the bathrooms too often throughout the day. Normal is to be able to go to the bathroom maybe about 5 to 7 times in a 24-hour period. And for most women, sleeping through the night without having to get up. When we get a little older, maybe getting up once a night. But if that does not sound like you, then there's a good chance that you may have some pelvic floor dysfunction. Third bladder issue that is a sign of pelvic floor dysfunction is bladder pain or burning with urination. Yes, burning with urination can be a sign of urinary tract infection, and you should definitely get checked out for that. But if the test for infection is negative, oftentimes your pelvic floor might be the source of the problem, and I frequently am working with patients who are dealing with that type of pain, and it can be bladder pain when your bladder's filling, when it's really full, even in the act of emptying. So this is, again, another common sign of pelvic floor dysfunction. The last one that I have for you today related to the bladder is difficulty starting urine stream or a hesitant urine stream. Okay, we are not designed to push to pee. We should be able to sit down on the toilet. Yes, ladies, you heard me. Sit down on the toilet. Don't hover over it, and just relax and let the pee come out. And a good pee, we should be peeing for 15 to 20 seconds. How long are you peeing for? But if you're having difficulty starting the stream, feeling like you have to push, where the stream is kind of starting and stopping, then we're having an issue, and we need to probably see a pelvic physical therapist to help with that. So again, this is Brooke from Legacy Physical Therapy talking about the 4 common bladder symptoms that are related to pelvic floor dysfunction. Stay tuned next time for the bowel symptoms. We'll be back.